the future of the space is going to be, the beauty of it is that we just don't know. But I think what we do know is that VR and AR are going to combine in some way. So I think the future of the space will mean that we will have products that completely take you away like VR does, and augmented worlds where we overlay content into those spaces. So I think the future will see a play on both of those technologies playing out, and which also play out from a consumer, how they actually kind of get used by consumers. So seeing how those two things play out will be important. We're just scraping the top of what VR can actually do for patients. And I think there is a depth that we will start to uncover. Ultimately, VR has, if you think of the affordance of what VR actually can do, it's well documented that it's an empathy machine. VR creates empathy that is, we struggle in books, in film, in lots of other media to actually grasp. So I think creating things that gives us empathy and gives us self-knowledge about ourselves will be really, really important. And then the other affordance is that we're tricking the brain. We're this exciting moment where we're creating, we don't know how we can manipulate what we see and how that affects us. So I think we will see a lot around that development of actually working out how the brain is responding to those visual inputs, and therefore what kind of content we can kind of pass back at that. I think we will also see, it's too much of a buzzword to say, but artificial intelligence, machine learning. I've just come back from MIT and seen the great things that are being worked on. It is about the data we collect, and also then changing the experiences and adapting experiences based on what you have learned and what others have learned, and manipulating that content to give you a personalized experience, not one that is for everyone. I personally am very interested in wearables, and actually in the time I spent in MIT, I connected with some people over there who are the wearable department, and I think that is fascinating, the work they're doing. I think how we measure our breath, how we measure our heart rate, how sweat on our palms, and how we create feedback loops into VR and augmented reality are going to be really important in the way we develop our products. So both from a clinician's point of view, so that they can see what is physically happening to someone, I think is going to be really important. But also on the other side of how we can give that feedback to a patient and get them to understand what they're seeing, what they're encountering in an environment is actually physically changing them. And that connection between mind and body is something they can control. And giving them insight into that, I think, is a really exciting area that we're going to spend a lot of time researching.